Hi, in the previous video, we had discussed about some of the practices we can do at home that will help reduce our TMD symptoms. We talked about heat and we talked about some of the home massage and relaxation, breathing, and some supplements and some systemic medicines. Today, we will discuss about some of the medical treatments we can do to help the situation in the clinic if those home remedies were not enough to solve your problem. First of all, when the patient comes to the dental clinic, we need to rule out any dental pain origin, because even if you don't feel the pain, it might be the cause behind your TMD pain. It's an internal pain signal that make you clench your teeth together and subconsciously lead to TMD pain. So we have to rule out mainly those big fillings that will need endo treatment that are necrosed, or some other periodontal problems that can lead to TMD. The other thing we can do, if your problem started because of a new restoration, a filling, a crown, or a bridge, whatever, that you started to have TMD symptoms only after that crown, you really need to go and get that resolved as soon as possible. Because once we remove the cause, like this high point, immediately all your symptoms within few days will go away. So it's very important that you get a proper restoration, and that tells us that even those micron, like what the doctor will adjust, will be only microns. Very, very minor adjustment will make a huge difference. And that's why TMD and this area and the teeth are very sensitive to even micro adjustments of tooth structure. The other most famous therapies we can do to help you is to give you a night guard. And a night guard is given to the patient who is usually a bruxer at night, who is starting to wear down their teeth, or they have a lot of pain in their muscles and in their joint. And the idea behind the night guard is that it will interrupt your pattern of biting, and it might reduce your clenching, but it will not solve your bruxism. So we don't give it because we guarantee that it will stop you from clenching, because you can start to clench and brux on the night guard itself. But what it will do is that it will protect the teeth, and what it will do is by interruption of your normal bite, it can make you stop clenching or grinding, and it will protect the teeth from further wear down. So it is important that we give this night guard to people who are bruxers, because many of them feel a lot of relief because they are not over compressing their joint due to their heavy bruxism. And you cannot believe how many kilos we put or pounds we put on our teeth when we do bruxism at night subconsciously, when we are not aware of the effect we are doing. We put more and more and more pounds and kilos. That's why it leads to wear down on the teeth and in the joint if it continues for a long time. Now, from my own TMD experience as a patient and as as a doctor, I came to the conclusion that not everybody should be given the same design of night guards. I've seen many patients who come with 10 night guards and they say none of them work. This is not comfortable and this is not comfortable. I totally understand your frustration. And I know that some patients, no matter what we give them of design, they will not be able to handle anything in their mouth. But what I concluded over my years of research and trial and error with this field, mainly as an orthodontist who deals a lot with occlusion and with different bite styles, that different bite styles needs different designs of night guards. That's why I started to give different ones based on the type of bite that the patient have. So some patients will give full coverage in the upper, some of them will get full coverage in the lower, some will take partial coverage, either upper or lower, based on their need. So this is something also we need to consider. So never give up on your night guard. Many patients do benefit from the night guards because it will interrupt their pattern of bruxism and will in combination mainly with the heat therapy, it can act like a magic to solve your problem. So me personally, I have a night guard that I keep and I wear when needed. Some days I have bad days with my TMJ. It comes back due to pressure that usually accumulate in my shoulder after a long day on the laptop, or even for us as dentists, our posture is not the best. So I start to have symptoms. Immediately I wear my splint and I combine it with heat or maybe with some of the topicals, and that usually should resolve it, and then I go back to normal. So the most important thing is that you need not to let it linger in pain for a long time, because it becomes harder to resolve. So always act on it, and be open to the idea that you might need to live with some. If your problem is chronic, you might live on and off out of night guards forever, who knows. And from my experience, there is a lot of controversy about the splint designs between the community of dentists. Some of them would swear with the upper, some of them would swear that only the lower, a certain thickness, certain type. And I'm telling you, that's why the confusion is there among the dental community about which type of splint. Whatever works, we will go with it for you. Now, the question about hard versus soft, this is another controversy in the dental community. Some people have a soft and it works for them, but most of the dentists, we don't like the soft one, although they can work for some people. So if you have it and if it's working for you, stay with it. If it's not working, usually I would recommend having a hard one, because the hard one will not allow you to seat your condyle and your joint and overpress the condyle in the same way that the soft ones do. And also one drawback of the soft one is that because they are chewy, some people might start to chew even more on them. So that's a drawback about them. Now, there are some other kinds that you can buy from the pharmacy, and you heat them with boiling water and you adapt them to your teeth. This can be a transient thing until you see your dentist, because usually their fit is not good. And because the fit is not good, you start to clench on them so they don't fall, and that defeats the purpose. But it can help in some patients because it's at least relieving the friction between the teeth, protecting them from wear down, and just interrupting the pattern of your normal bite. And this is sometimes only what we need to do to get out of the cycle of clenching. But to conclude, the splints or night guards will not stop your bruxism. All what it does is that it will protect the teeth and interrupt your pattern, and that by itself, in combination with the heat and other therapies, can help your symptoms that come out of the bruxism. Another treatment modality we can consider is physiotherapy. Sometimes patients, even with the heat and the night guard, they still have the symptoms. So I send them to the physiotherapist, because the physiotherapist will have more advanced techniques that can penetrate even deeper, and that will help the healing happen at a better level. Like they can use ultrasound, laser, TENS machine that is professional, and they do their manipulation and myofascial release protocols that will relieve the symptoms and the knots in the muscles. Like we can see in this picture here, the therapist is trying to stretch back the muscle to its normal length, which will solve the problems of the knots. Another therapy we can consider is what we call trigger point injections or Botox injections. Trigger points injections are basically injecting the lidocaine, which is the anesthesia solution that we use, in the knots. If there is a knot that is really tight, you know how sometimes when you do a massage, then you find a knot and the therapist start to want to kind of release it. Same thing can happen in the masseter and temporalis, that we have knots and they are not going away on their own. So, and they are causing pain. So what we can do is we can inject this lidocaine solution, which will anesthetize the knot and help it to dissolve. So that many times can be helpful in terms of pain. So we give it like we see here in the masseter or the temporalis muscle. And in some cases where we have severe spasm in the muscle, or in cases of bruxism that are not able to tolerate the night guard, or there is a muscular problem that's so strong, we can go to Botox injection, but usually we keep it as the last reservoir because we don't want to use it regularly, because otherwise you have to use it every 4 to 6 months, repeat the injection, because it's getting out of our bloodstream and we need to repeat it. So where do we inject it? We inject it usually in the masseter and sometimes in the temporalis. This will allow the muscle not to be able to contract to its full strength. So usually it will contract to, depending on how many units you get, it will allow it to contract in less forceful way. So this will reduce the symptoms, and this will not allow you to bite as forcefully and to damage your teeth. And then finally, another way to treat this is by doing dry needling or acupuncture. Dry needling is basically the same idea of the trigger point. We put the needle inside the knot and we let it stay there for a while, or we move it around to break out the knot. To be honest, I tried it and it is painful when we insert, because we are inserting exactly in where the center of the pain is. But to be honest, it's very, very useful. It brings a lot of redness to the area, and within few days it feels like a totally relieved area. Same thing with acupuncture, although it's a different philosophy. Acupuncture goes with the meridian lines, and they have a special points that they do to coordinate the energy flow and to relief, and they put in the crown area and in other points depending on what is your need, and it can also help. So as you saw, we have many techniques, and every technique will depend its usage on the case. We cannot decide before we examine properly the history and we try it out and we see how it goes. And in the next video, I will tell you more about some of the more advanced techniques that we can use in the dental clinic for people who have more major problems, and all these techniques still haven't helped them.